Hey guys, today we're going to talk about, is our arm pain coming from our neck or from our arm? Oftentimes people will come in and they'll say they have a shoulder or a wrist or an elbow or carpal tunnel problem, and they think it's coming from their actual arm or shoulder, but in reality it's coming from their neck. In fact, there's some recent research that shows that over approximately 50% of extremity complaints are coming from an asymptomatic spine, meaning that their neck or back feel fine, but they may be experiencing arm, shoulder, knee, or leg pain. So obviously that's a lot of people, so we want to determine, is the problem coming from the actual arm itself or from our neck? So some very simple and easy, quick to do tests that we use in clinic here to determine if it's coming from the neck is, I'll just show you here. So the first one, we want to lift the arm above our head and just kind of rest it on our head. If this alleviates your arm or shoulder pain, chances are that it's coming from your neck. If we have a disc herniation compressing a nerve causing arm pain, typically, if we lift our arm above our head and rest it up here, that takes pressure off of that nerve, hence alleviating the arm pain. Another test we'll do is an arm squeeze test. Basically, we'll wrap our hands around the person's arm and squeeze it. If that elicits their arm or shoulder pain, again, we're thinking it's coming from a nerve problem originating from our neck. Another test we'll do, quite simply, is we'll ask the person to move their head around. Turn it side to side like this, up and down, and if that's causing any of their arm pain, chances are at least a portion of that arm or shoulder pain is coming from the neck. Another test we'll do is get them to cough or sneeze, and again, if that's eliciting arm pain, typically that again is coming from, you guessed it, the neck. Another thing we'll do is we'll press along the front of the neck here. Now this is actually where those nerve bundles kind of come out of your neck and then they travel down your armpit and into the arm and into the shoulder. So if we press in through this area and that elicits, again, arm pain, then chances are that, again, their pain is coming from their neck. So that's why it's important to determine, is the pain coming from the neck or is it coming from the arm or shoulder? I recently had a patient the other week. They had been seeing a different practitioner for a shoulder problem, or what they thought was a shoulder problem, over approximately 8 months, I believe. And I asked them, how much better is it feeling? He's like, oh, about 20%. That's great. So just another 2 years and you should have a 100% working arm. Obviously, this isn't a good thing. So I asked if we could take a look. We did. What that other provider had been doing is locally treating the shoulder. If the shoulder was the problem, you would think that it would be better. So I decided, hey, let's take a look at your neck. Possibly it's coming from there. So I did my evaluation, decided, hey, this probably is coming from your neck. Did a treatment targeted at the neck. I didn't touch their shoulder at all. And when they came in, they were lifting their arm about here with quite a lot of pain and discomfort in this region. So thinking like a rotator cuff problem. I treated their neck, and lo and behold, he's able to get it all the way up here. Very minimal pain, discomfort, feeling about 90% better just after one treatment session. So in his case, obviously it was coming from his neck, and it could be coming from your neck too. So it's important to know where that pain is generating from.